void beyond the mind, the empty space that circles time. I see where others stumble blind to seek a truth they never find. Eternal wisdom is my guide. I am the doctor.
Yep, I am the doctor. And the doctor is in. I am sitting down and I'm waiting for my patient. Are you my patient? Well, welcome to the program Doc Talk right here on Vicky Lonia Radio. And trust me, when it is Doc Talk, then it is time to talk your health. It is time to talk your total well-being. And whenever I am on this program, whenever it is time for this program, I suddenly become a doctor. I'm no longer an entertainer. I'm no longer the talkie-talkie. I'm no longer the walkie-talkie, whatever it is. I am now a full-fledged certified doctor ready to talk on your health and total well-being because it is the program Doc Talk. And I am a doctor right about this moment. All right, so in 2 minutes gone past the hour of 12. And I, first of all, will say I'm so sorry for coming on air late. I had some technical issues, but that is resolved. So today on Doc Talk, I have this really great topic, this really great health condition that I would want us to look into. It is a mild condition, but trust me, because it is a common health issue, people just take it for granted. They just feel it's nothing. It's something that can be handled at any time, anywhere. Really? I am so sorry because by the time I'm done with this topic today, you would have come to understand the fact that it is not just any other kind of disease. This one is for real. And when it is being taken for granted, something bad is really going to happen. Okay, so we're going straight to the topic proper. But before then, I always love to bring the action anytime I'm on air. So, let's bring the action.
Bring the action.
We're ready. That's a signal. We are ready to move into the program proper. It is Doc Talk right here on Vicky Lonia Radio. So today on Doc Talk, let us talk about a rare mouth disease. A rare mouth disease called stomatitis. I take that again. A rare mouth disease called stomatitis. Stomatitis is a mouth disease that is so common, but we take it for granted, and it's because probably it hasn't happened, it hasn't caused a major issue. Maybe to you, that's the reason why you feel it is nothing. Look, our health is very important to us, and as to that, we need to take care of ourselves. Those little things you think don't actually matter are the things that really, really do matter. Stomatitis is a rare mouth disease. Okay, it happens to us once in a while, but let's just say by the grace of God, it doesn't escalate. Now, let me tell you what stomatitis is, okay? So that when you guys, if you are not careful and it escalates, well, don't say you aren't told. Now the doctor is in. So what is stomatitis? Stomatitis is an inflammation, okay? It is the inflammation or what we call ulcers in the mouth, okay? Stomatitis is inflammation or ulcers in the mouth. When you say ulcer is an injury. Ulcer means injury, okay? Now, it is an injury in the mouth. Sometimes it is called dental stomatitis or it is called denture stomatitis, okay? Medical students are in the house so that we can get this right. All right, so sometimes it is called dental stomatitis when it affects the teeth, okay, or the gums, okay, and then, or it is called denture stomatitis, same thing. Now, the mucous membranes lining the mouth are injured or they get sore. Okay, when they get sore, it can make it very uncomfortable for you to speak, eat, or even sleep. That is how bad stomatitis is. Okay, it's not just that ordinary mouth injury you have, but bear in mind that even the ordinary mouth injury you have could actually escalate to stomatitis. Okay, the mucous membranes lining the mouth, they get inflamed, get injured, which can make it very impossible for you to speak or eat or even sleep. Okay, this condition can occur anywhere within the mouth, including inside of the cheeks, inside of the gums, the tongue, the lips, and the palate. Okay, so the condition does not get passed on to other people. All right, you don't, when you touch it's not contracted by touching someone, or it's not a sexually transmitted disease. Okay, even if you kiss the person doesn't mean that you're going to contact stomatitis. Okay, so who gets stomatitis? Who are the people that end up getting affected by stomatitis? Now, wearing dentures or braces can increase the chances of getting stomatitis. You know what braces are? Those things you wear as a little kid in order to take care of your teeth. Braces, they kind of, how am I going to put it now? I think those braces, what they do is I think when you're having issues with your teeth, something like that. Medical students in the house, are we here? All right, so it's braces are for the teeth, okay, in order to keep it in order, to arrange them, keep it in line. That's what those braces are. Okay, so wearing dentals or braces can increase the chances of getting stomatitis, as these may cause irritation. Those braces, they are metallic. Okay, they are metallic. When you wear them, it's very possible that you can get an injury, which could lead to some kind of ulcer, and then from there we are talking stomatitis. Okay, because they cause some sort of irritation to the outer lining, to the outer membrane of the mouth. Okay, it could disturb your gums or your cheeks or your teeth, whichever one it is. As long as once an irritation occurs, there is a big chance of you getting stomatitis. Now, it is also common in people with some medical conditions like diabetes, and those people who also take steroids and antibiotics. Okay, those people who abuse steroids, those people who take steroids to enhance their physical capabilities and all that, like muscle strengtheners, and those who take steroids to build, those who take steroids to build their muscles. Most of these sports men and sports women that take steroids to build their muscles and all that, okay, to increase their physical capabilities. Okay, and those people who have diabetes, those people who abuse antibiotics, they stand a great chance of actually contacting or getting affected by stomatitis. Okay. Now, what are the symptoms of stomatitis? The symptoms of stomatitis includes mouth ulcers, where you get to notice mouth injuries. Okay, you get to notice some injuries inside your mouth. Okay, often inside the cheeks or on the tongue or inside the lips. Okay, and then also another symptom is cold sores. You see sores around your mouth or blisters caused by herpes virus around the lips. Okay, if you have herpes virus, there's every chance of you getting stomatitis. Okay, and also when you have mouth irritation through those braces, or probably you use something in your mouth that causes irritation, any unwanted thing, maybe you are the type that has tongue ring, tongue pain, lip ring, those stuffs could actually lead to stomatitis. Okay, so those are symptoms. So when you wear those things and then you start noticing some sort of mouth irritation, some cold sores, mouth injuries here and there, you know that you are having stomatitis. So what are the causes of stomatitis? Okay, let's look at that now. What are the causes of stomatitis? The causes of stomatitis includes biting the cheek, biting the cheek, tongue or lip. Okay, when you, maybe for example, you're chewing gum and then you bite your cheek. Okay, and somehow, so unlucky for you, you let it be, thinking it's just going to be a normal thing, it's gonna go, and then if you're so unlucky, you have some sort of germs and diseases in your mouth, you're the type who don't practice good mouth hygiene, those germs and diseases get into the sore in your mouth. We are talking stomatitis right about now. Okay, and then wearing braces, using dentures, or a broken or a sharp broken tooth could cause stomatitis. Okay, if you break your teeth and it's sharp, or somehow you got into a fight, your teeth gets broken and it doesn't pull off, it just gets broken and the other half of it is still stuck in there, you have to do something about it. So we're going to be talking a huge stomatitis right about now. Okay, now chewing tobacco. Those people who have tobacco, those old men, and even young guys and young men, women, ladies who chew tobacco, okay, or should I say tobacco? Okay, so all right, tobacco. So those of us who happen to chew tobacco at all times, you stand a high chance of getting the high risk of getting stomatitis. Now, when there is a burning in the inside of the mouth, probably with hot food or hot drink, you take something hot, really hot, and it burns you. Yes. It burns you. It could also lead to stomatitis. When you have gum disease, or what we call gingivitis, okay, gingivitis. Gingivitis is called gum disease. Gum disease is called gingivitis. Both of them are the same thing. Okay, so when you have gingivitis, which is gum disease, it could cause stomatitis. When you have an injury, when you have a disease on your gum, okay, your gum is what holds your teeth down, okay, puts it in place. Okay, now when you have some sort of infection on your gums, it could lead to stomatitis if not treated properly. Okay. Also, we have mouth infections. Mouth infections could lead to stomatitis, and then we also have sensitivity to some foods or ingredients. Sometimes your mouth is sensitive to some kind of food. Okay, when you eat that kind of food, chew it affects you. Okay, and if you're not careful, it could lead to stomatitis. Okay, sensitivity to some sort of medication, and when you're reacting to some sort of medication, okay, it could lead to stomatitis. Having some autoimmune conditions, including lupus, Crohn's disease, Behçet's disease, radiotherapy, cancer treatment, these things could lead to stomatitis. There could be side effects. Okay, and the side effects could be stomatitis. So tell me, now you're going to ask me, now we know all this, we know the meaning, we know the causes, we know the effects. Can you please tell us the treatment already? Yes, the treatment for stomatitis, it can be cured. I know that's what you're scared of. You want to know whether it can be cured? Yes, it can be cured. Now, the main treatment for stomatitis is good oral hygiene. Please, that's it. Simple. Keep a good mouth hygiene, a good oral hygiene. Brushing the teeth twice a day and other things your dentist may recommend, such as flossing or mouthwash. Okay, that is literally the cure for it. So it is basically prevention is better than cure. All right, prevent it. That's the best cure. Practice good mouth hygiene. Wash your mouth always. Whenever you finish eating, make sure you rinse your mouth, take away whatever leftover debris is in there. Floss your teeth. Visit the dentist at all times and listen to whatever it is your dentist has to say about your mouth. And then if the dentures and braces, if you're the type that uses dentures and braces and it's causing problems, see your dentist, okay? And better cleaning may need or may be needed or adjustments for the dentures or braces that you are using. Okay, it could have been affected maybe with the food you've been eating and some sort of that been storing somewhere there, and it's causing the braces to rust, and then which leads to ulcers in your mouth, and from there we're talking stomatitis. Okay, so let your doctor, your dentist help you out here. And then painkillers may help with the discomfort when you already have the stomatitis and you're in pains. Of course, your doctor will recommend some painkillers for you. All right. Now, if you're at home and you want to do some quick home treatments before you visit the dentist, avoid food or drink that's too hot. Okay. Avoid those kind of spicy food or hot food or too cold kind of food or drinks. They could really affect you, cause more problems for you. So avoid them. Okay. Gargle, you can gargle with salt water. Okay, gargling of salt water. Just put your salt inside the water and just gargle around the mouth. Okay, it will help rinse the mouth and take away all the germs and diseases, the ones it can actually take away before you go see the dentist. And then there are some gels for mouth ulcers. When you go see your dentist recommends some gels for mouth ulcers. If you have those at home, you can as well start using them. Okay, so we have over-the-counter treatment, like you visiting a pharmacy and know that they give you something to go with. Alright, that's all I've got for you right here on Doctor today, and I'm so glad that you were a part of the show. Please share this out to other people. They might really want to know what stomatitis is all about. Good day, all of Mr. Remains, Vicky Lonia.
Oh,